Hi everyone, welcome to Public Health Nursing Study Group with Id.Chimedics. My name is Id.Chimedics and we'll be starting with class 1. I'll be taking you on the introduction to public health nursing. So ensure that you get your pen, your jotter ready as we begin. Okay, let's have it. So I'll be starting with concepts of public health as well as primary health nursing. Public health nursing focuses on what we call the health of the population. Of course, you should know, as the name implies, public health. So it focuses on the health of the population, and it promotes, it maintains, it restores the health of this population through evidence-based practice. And this evidence-based practice is aimed at preventing disease and prolonging the life of the population. Don't forget that it focuses on what? It focuses on the population, health of the population, by promoting, maintaining, and restoring their health to achieve prevention of diseases as well as prolonging life. I want us to also understand that the core concept of public health nursing is rooted in primary health care. That's what you call PHC. So you can't do public health nursing and leave primary health care, because the core concept of public health nursing is rooted deep down in primary health care. And take note that this primary health care involves providing affordable and accessible care to individual. Okay, care that is affordable, care that is accessible to individuals, especially in rural areas and that is underserved, those areas that are underserved. Take note of that, and you should know why it is affordable and accessible is so that these people in the rural areas can, access this health care and still gain what they need to gain, even in the tertiary health care as well as the secondary health care. Okay, before I continue, I'll give us a little quick definition of what primary health care is. Primary health care was defined in Alma Ata Declaration. Take note that it was defined in Alma Ata Declaration of 1978. Take note of the year because it comes out in NMCN. So it was defined in Alma Ata Declaration of 1978 as an essential healthcare based on scientifically sound and socially acceptable method, making it accessible to all individuals at cost they can afford. Okay, you should know the other addition and subtractions. I'm just giving you a little summary. But take note that primary health care emphasizes community participation. Primary health care emphasizes intersectoral collaboration. Primary health care also emphasizes on health promotion. Take notes. Okay, I'll go a quick one to history or historical perspective of public health public health nursing, which is our next online. Take note that public health nursing is, as I said earlier, is rooted in primary health care, and it has its root in the work of Florence Nightingale. Florence Nightingale, our mama with the lamb, she did a whole lot of work, and this was in the year 1820 to about 1910. Florence Nightingale advocated for sanitation and disease prevention. Of course, you should know that when the environment is not clean, that is the bedrock of disease. That is just the author of disease. So she advocated in this year 1920 to about 1910. She did the whole work of advocating for sanitation and the communities and the whole environment and disease prevention. So her contribution during this what we call the Crimean War led to the foundation of modern nursing practice. This is what brought about modern nursing practice. But take note, in Nigeria, public health nursing evolves alongside colonial and post-colonial health system. During the war, take note that the establishment of primary health care in Nigeria following this 1978 Alma Ata Declaration further formalized public health initiative. with focus on rural and community health services. That's why majorly you see that public health nursing really focuses on the rural area, focuses on the community health services to ensure that they are carried along, they are not neglected, and this was brought about from our mama, Florence Nightingale. So take note, that's a little historical perspective, but I'm giving you the key historical milestone you need to know. Key historical milestone in Nigeria, how it came into Nigeria proper. So the first under the historical milestone in Nigeria is colonial era. Of course, you should know, as I said earlier, that the introduction of public health services was brought about by the colonial authorities. Okay, so this was brought about the public health, or call it public health services. The next one after the colonial era was the post-independence era, and here there was expansion of health services leading to establishment of what we call National Primary Healthcare Development Agency. You used to hear NPHCDA, National Primary Healthcare Development Agency, and this was brought about in 1992. So they might ask you in exam, NPHCDA was brought about in which year? 1992. Establishment of what? National Primary Health Care Development Agency. So this was brought about in 1992 and is during the post-independence era. There was expansion, as I said earlier, of these health services that was brought in the colonial era. Take note that modern public health nursing came to play after the post-independence era, and this modern public health nursing proper focused on immunization, maternal and child health care, as well as proper disease prevention. Please take note. So take note that the philosophy of public health nursing is built on the principle of prevention over cure. You prevent instead of curing. It's better to prevent than curing. Take note, you prevent in order not to cure. So it promotes equity in healthcare access and work to address the root cause of the illness. It suppresses the illness by ensuring it doesn't even come to play. Such as environmental and social factors are trashed out in order not to bring about illness. Public health nurses aim to empower communities through health education, prevention program, and advocacy. They do this in order to empower the communities to rise up. When you hear community participation, community mobilization, in order to prevent diseases. You can't do it by yourself. You have to involve and collaborate with the community in order to prevent this disaster. So some of the health, or what we call core philosophical belief that was brought about was, number one, that healthcare should be equally accessible to everyone. When it is accessible to everyone, you see that it helps everyone to achieve those services they require to prevent disease. Community involvement. The second one is community involvement is essential for successful health intervention. I told you, as a public health nurse, as a public health personnel, you can't do it on your own. So you have to involve the community, and it's very essential for health intervention, because without you can't just gain entrance into the community. You have to meet with them. You have to involve with them. You have to get them carried along. Take note, the third one, which is the last, is that health education is a powerful tool in promoting sustainable health practice. And this is what I want us to understand, that the SI unit of this health promotion, health prevention, disease prevention is health education. It's a powerful tool in promoting sustainable health practice. I run to the next one, which is quality of a public health nurse. These are qualities, and I'll give you a few. There are very many added qualities, but I'm just going to give you a few that will help you. The SI units of a public health nurse. The qualities of a public health nurse The public health nurse must have, for you to be a successful public health nurse, you must have a combination of a personal and professional quality to effectively manage the population health. Of course, you should know, when you don't even, in fact, in any other association, in any other profession, discipline, or whatever you might call it, if you don't have a personal quality, your own personal attributes, combined with your professional attribute, the ethics, the lifestyle, it is a problem. So for an effective management of public health or the population health, a successful public health nurse must have a combination of personal and public, or what we call professional qualities, and which include, number one is communication skill. The ability to interact effectively with individuals, family, and community must be backed up with your communication skill. If you don't have a good communication skill, it is a problem. You can't cope. You can't be a successful public health nurse. Possibly you could be a public health nurse, but it might not be a successful public health nurse. So take note of that. You must have a good communication skill to interact effectively, to know their problem, to dish out what you have for them through health education, to diagnose them, community diagnosis, to know their problems, to hear from them, and to give them a good feedback. This is all about communication skill. The next one is called cultural competence. You cannot see yourself going to a new community and you don't respect and understand their different cultural belief. You must have respect and understanding of different cultural belief and practices. You don't need to be carried away. You don't need to be overwhelmed like, what is happening here? You have to be ready to understand, ready to respect these beliefs and practices. That doesn't make you to practice what they are practicing, but you need to understand and respect so you know where you come in as a public health nurse. Next one is empathy and compassion. Of course, you should know all nurses should be empathetic. Of course, empathetic, not sympathetic. Empathetic here, of course, you should be sensitive to their condition. You should put your leg in their shoe and show that compassion, the sensitivity to the unique health need of this population. Then the next one is called the critical thinking. Of course, you should know as a health practitioner, you have to think critically, to have the ability to assess situation and diverse practical solutions. You have to think beyond the box. You have to think far. You have to think wide. Be versatile. You get it right now. Ensure that you also have the quality of adaptability. Okay, adaptability here will help you become flexible in diverse work environments, including the rural area, the urban area, wherever community you're going to be serving. It helps you to be flexible, to stretch out. That is called adaptability. You have to adapt to any condition you see there. Now, the next one, which is going to be the last one for now, you can go and check more. There are more. We have is called leadership and advocacy. One of the very important rules you'll be taking as a public health nurse is leading. And one of the rules is also advocating. So actively promoting policies and programs to enhance public health is one good thing that will back up your leadership skill. You have to understand policies that will promote the public health. You also enhance programs for the public health to help prevent disease and enhance long life of the community, of the population. I'll run down straight to what we call principle of primary health care, which is a root in public health. So quickly, the principles of primary health care, which is one of the subtopic under introduction to public health, is, of course, you should know that everything backed up by the principle of primary health care is from WHO. So WHO outlines several core principles for primary health care, which public health nurses must apply in their practice. You have to apply all this in your practice. Number one is called equity. Okay, principle number one, equity, is having to ensure equal access of health services for all. You remember that in Alma Ata conference in 1978, you remember that it was declared health for all. WHO declared health for all, not for your grandfathers, not for only your grandmother, not for your mother's side, not for your father's side, but health for all. Not only for your children, but for health for all community members. Take note that community participation engages communities in planning and implementing their initiatives. So that's principle number 2. You have to ensure that there is community participation. It brings about engaging communities in planning and implementing health initiatives. Now, principle number 3 is health promotion. So it focuses on prevention rather than cure, as I stated earlier. It emphasizes healthy living. It brings about healthy living in order for them to work hard to prevent disease. The next principle is called intersectoral collaboration. Now, this is very important among healthcare sector or among healthcare in the healthcare system. So it involves coordinating healthcare with sectors like agriculture, in terms of food productions, animal, all those farming things that has to do with production of edibles, livestock, farm implements, and the rest. Education helps in school health program, teaching and ensuring community education and the rest. We also have social services. All this is to address the broader determinants of health. There are many determinants of health. That is assignment for you. Ensure you put it on the comment section or on the group chats. Go and check determinants of health. Then the last one is use of appropriate technology. I think this is one of the things I didn't add up to the definition of primary health care. There must be appropriate technology used. So the last one is use of appropriate technology. So ensuring that medical intervention and technologies are accessible, they are affordable and culturally acceptable. Let's run down to health patterns of the population because of our time. Public health nurses must also ensure that they are knowledgeable about health pattern. They must be very, very conscious of that. They must be sure that they are knowledgeable about health pattern that affect different populations to provide effective care. Now let's run down to first health pattern is disease prevalence. Ensuring that they monitor common diseases such as malaria. These are diseases that are reigning. That's why I call it disease prevalence, that they are reigning. HIV and AIDS, tuberculosis and other within a population. You have to monitor for this because you know that they are prevalent. They are always occurring and reoccurring. Now, this one is called maternal and child health. You have to ensure that you track infant and maternal mortality rate. Ensure that you are immunizing properly. There should be that immunization schedule, which I taught earlier in my last class. There must be an assessment of nutritional health of these children as well as the mothers to ensure that there's reduced maternal and child mortality. Of course, you should know that. Then this one is called environmental factor. This is another health pattern health pattern of the population you need to check or checkmate. It's called environmental factors. Assessing the impact of environmental issues such as sanitation, clean water availability, pollution of health. This pollution can cause serious chaos to the health of an individual, so it must be checkmate by you, the public health nurse. Next one is called behavioral risk factors. There are some of them that do activities or some lifestyle behavior that increase their health risk. Some of these things can be one, we have smoking, we have some physical inactivity, poor diet. These are things that can affect the health of this individual. I'll run down straight to the last part of these studies, which is called organizational scope, study and function of the committee in primary health care. I want us to all know that in Nigeria, public health services are delivered through a network of primary health care development committee. For this public health service to be delivered, there must be a rundown, a network of Primary Healthcare Development Committee, and this committee work at various levels to coordinate health services, promote health education, and ensure delivery of essential healthcare services. And that brings me to what we call organizational scope, structures, and function of development committee in primary healthcare service. In Nigeria, number one is called the Village Development Committee, VDC. You will see in exams VDC. It's called Village Development Committee. What is their scope? Their scope is operating at the village level to address what we call local health issues. And their function is majorly promoting health education, supporting immunization campaign, ensuring access to maternal and child health services, and reports any health concerns to the higher authority. Remember, their scope is operating, they don't do more than themselves. Okay, they know they carry you go where you don't know. They operate at the village level to address local health issues. So take note of their function. The next committee is the Health Facility Development Committee. When you hear HFDC, the health facility, this one is linked to the local health facility. They are like the clinics or health centers. You should see them around your community. If you go around, you see their function is just to oversee the operation, of the health center. They collaborate with the community to improve the health services and ensure adequate staffing and resources. They're just, the health centers and the rest. Next one is called the District Development Committee, DDC. Their scope is covering multiple villages and towns within the district. So it's kind of a wider form of the Village Development Committee, VDC. So it's DDC. It covers multiple villages, towns, as well as, it's like within a district, it covers a district. So the District Development Committee, they has its function to coordinate the health services across district. They implement what we call primary healthcare program and monitor the health statistics. I can remember sometimes some of these district development committee, they go to villages, they go to health centers to get statistics of people that are immunized, statistics of people that are infected, people that have received drugs that have been given by NGOs and the rest. They just, they do some of these things. They work across the district. They implement programs like immunization programs, seminars, health education, and they also help, just as I said earlier, to monitor health statistics. The next committee we'll be looking at is called the Local Government Area Primary Healthcare Development Committee, LGA Primary Healthcare Development Committee. They operate at the local government area level. Yes, that's their scope. They oversee health services across multiple districts, and their major function is to develop local primary healthcare policies. They also help to manage health resources and also support these health promotion we've been talking about and health disease prevention initiative. So that's the basic thing they do. I will run down to other communities without wasting time. The other communities are like State Implementation Committee. After the local government committee, we have the State Implementation Committee. This is just coordinating this committee are in charge of coordinating the primary healthcare initiative at the state level. They ensure they are all aligned with national policies. We also have the National Policy Implementation Committee. This just helps to oversee the national PHC strategy, and they ensure the policies are in alignment, they are obeyed, and also ensure that its implementation across the state and local government are properly run down. You should know. So those are the basic or the important committees as regards organization scope. That's organization scopes as well as structure in the primary healthcare service. That is when we talk about Nigeria here. Take note of that. I want to summarize this class 1 by letting you know that public health nursing plays a very important role, as I said earlier, in promoting health and preventing diseases at all population level. It's called public health, so it's population based. And public health nurses in Nigeria work within a structured system of development committee to deliver this primary health care, which I listed that structure. The committee is in charge. And take note, all this is to ensure that health services are accessible, affordable, and effective, especially for the rural and underserved communities. I want you all to read up and ensure that you answer the quiz at the end of this lecture. That's when you've gotten the material. I've dropped the material on Seller, and if you want the material from me, you can private chat or you can message me. I want you all to answer those questions as we prepare for our next class. See you in next class.